This is WPSL Port St. Lucie, the talk of the Treasure Coast.
Views expressed on the following program are not necessarily those of WPSL, but you're encouraged to like and share them on Facebook. Also, put your thinking cap on tonight. You heard about the open enrollment that we just played just seconds ago. It's time now for the African American scene, and Rudy's got a surprise for you tonight, so don't be hateful tonight. You're going to learn something. Be careful, you might just learn something tonight, because it's time for the African American scene with Rudy Howard.
Good evening, good evening, good evening. Always glad to be with you here on a Wednesday night. No politics tonight. I promised you last week that I was dedicating this show to Medicare. And that's what we're going to do tonight. We're going to talk Medicare. And I hope by the time I'm finished with this show, I can't give you every minute, tiny detail, but I will give you enough information that should help you to make some good decisions about what you need to do as far as your Medicare is concerned. First, let me say this. I hate those dag-blasted commercials that they're running that says, you can get $144 back in your thing, and you can get this, and you can get... Okay, are those commercials untrue? The answer is no. They're not untrue, but here's how Medicare works. It's territorial. The plans that I have available to offer you in St. Lucie County are different than the plans that are available in Palm Beach County, Broward County, and Dade County. We all have different plans. Don't ask me why it's set up that way, but that's the way the situation is set up. Like, there are plans in Broward County where you can get money back. Okay, so just keep that in mind. I think there's one plan here that may do that, but most of the plans here do not offer that as a option. Now, let's talk about Medicare. I'm going to try to take you from the very first part of it, which is getting your Medicare card. First of all, and I've run into this recently, your Medicare card has changed. As you know, your Medicare card was basically your Social Security number with an alpha character at the end of it. That's no more. And it hasn't been that way now for 2 years. So there's a good chance if you haven't changed your plan in a couple of years and you wanted to talk to somebody about a plan, like a person came to my office and we were sitting down going over the plan, and I said, that's not your right Social Security card. And he said, yes, it is. I said, no, it's not. And he looked in his wallet, and he did have his new card. Now, the reason they did that is because they wanted to get away from having your Social Security be an identifier as part of your Medicare identity. So, your new Medicare number should be a combination of letters and numbers that have nothing to do with your Social Security card. So if you don't have that, you did get it. You either threw it out or misplaced it. And if you don't have that and you want to make changes, you need to get another one. Okay. First thing, and the number is 340-1590. Please feel free to call. At this point, I'd like to consider myself a quasi-professional at this, a quasi-expert, so I can probably answer pretty much any question that you have. Okay. When you get your Medicare card, your red, white, and blue, I'm talking about the red, white, and blue card, there is a Part A and a Part B. You get that card when you turn 65. Now, in some instances, you may get your red, white, and blue card earlier because you choose to draw some of your Social Security benefits but you don't want the health portion. The Part A coverage of your Social Security has been paid for by the deductions that you've made over the years. Your Part B, which is $144 or $146, is your contribution to pay for your Part B coverage. Your Part A is basically your hospital, and your Part B covers your doctor visits, labs, etc. Now, in order to participate in a Medicare Advantage plan, you must have Parts A and Parts B. Okay? That's a requirement. I cannot put you in a Medicare Advantage plan unless you have both parts. You can get a prescription drug plan if you have Part A and you don't have Part B. Now, here's the other part of this that you should be aware of. You're allowed to waive your Part B expense if you have creditable coverage. What does that mean? That means if you're still working and you have coverage at least as good as Medicare, you can forego the cost of Part B. Let me repeat that again. Creditable coverage means that you have a plan at work that affords you coverage that's at least as good as what Medicare offers. If it's not at least as good as what Medicare offers, that will not count as a waiver of your Part B. You will be required to buy your Part B. Now, if you don't buy your Part B, you will get a penalty. And it's a permanent penalty that is attached to your costs going forward. It never goes away. So instead of that being 144, it'll be 150 or 160, whatever the number is. It gets attached to your Part B costs, and it's permanent. Now, on occasion, I've run into people that said, well, I really didn't think I needed it. I felt good and this and that and the other. Well, let me tell you, the law says you must get it when you turn 65. Okay? If you don't get it, then you get a penalty. The other thing that takes place when you're 65, you have to get a prescription drug plan. So in addition to your Medicare, you have to get a prescription drug plan. That's been a requirement since 2010. All right? Again, the phone number is 340-1590. Okay, so now you know if you don't have your Part B coverage on your red, white, and blue card, you can get a prescription drug plan, but you cannot get a medical advantage plan. And you can waive your Part B premium, which is that $144 or $146 every month, and that number is adjusted based on your retirement income. You know, there might be people paying $150, $170, whatever. So just know that. But the standard premium is $144, $146 right there. I can't remember whether it's 44 or 46. And I should know that, especially since I'm paying that doggone thing myself. Okay, so we got that straight. Again, just one more reminder, if you don't get the Part B coverage, because this is really important, you'll get a penalty. If you don't get the Part D coverage, you'll get a penalty. Okay, let's talk about enrollment periods. You see this on TV all the time. It says open enrollment October 15th to December 7th. That's accurate. That's what's called the annual enrollment period. You hear that on my commercial. every year between October 15th and December 7th, you have the opportunity to make changes to your existing Medicare coverage. You can change plans, and you can talk to your agent or whoever to see if there's been any changes. And I will tell you, changes do occur from year to year because the companies are in competition with each other. So each company knows what the other one's doing. And so they will, a lot of times, modify their offering to try to compete with the other people in the marketplace, okay? Now, let me define for you the enrollment periods. You have the initial enrollment period, you have the annual enrollment period, you have the special election period, and you have disability enrollment period. Okay? And you also have an open enrollment period, which begins on January 1st till March 31st, at which time you can change from one medical advantage plan to another, or you can opt out of a medical advantage plan and go back to Medicare and a prescription drug plan. If you fail to enroll in Medicare during your initial enrollment, you can enroll during the general enrollment period, which is from January 1st to March 31st with effective date of July 1. Okay, so you got two periods there of January 1st to March 31st. One is the general enrollment period, and one is the open enrollment period. Just remember, the general enrollment period is for people that failed to sign up during the initial enrollment period. So let's talk about the initial enrollment period. What is that? The initial enrollment period is the time in which you first become eligible for Medicare, your red, white, and blue card. You get basically 7 months to complete an enrollment, which is quite generous. You get the first 3 months before the month of your 65th birthday, the month of your 65th birthday, and you get the 3 months after your 65th birthday in which you can enroll, and you will not incur any penalty. My suggestion to you would be, and I tell people this all the time, why not enroll prior to the month of your 65th birthday? Because if you do that, your coverage will go in effect on the first day of the month in which you turn 65. So if your birthday was, for argument's sake, January 25th, if we signed you up in November, on January 1st, you would have an active Medicare policy. Okay? So just keep that in mind, that the 3 months before the month of your 65th birthday and the 3 months after is your initial enrollment period. Your annual enrollment period is the period which you see on TV, which is October 15th to December 7th, which occurs each year, in which you have the opportunity to change plans. And we have Greg on line one. Yes, sir.
Rudy, thank you. I started Medicare last year.
Okay.
I'm eligible for my Social Security in 4 months. I started Medicare with a company that I'm not completely happy with. I won't say the company on the air. But should I change now, or should I write it out with them? I haven't had any medical claims. I haven't had any medical issues. I haven't had any anything for me personally to be annoyed with them. But I have my son, who's in college, on their plan, and it annoys the hell out of me.
Okay. So you turned 65 when?
I turned 65 last April.
Okay.
66 in 2 months in June.
Okay. So are you drawing your Social Security now?
I'm not drawing Social Security, but I am on Medicare.
Okay. Okay. So you're paying for that out of pocket. That happens for sure. Okay. Well, here's what I would say. If you're not happy with him for whatever reason, you have until December 15th to make a change. It's perfectly okay for you to make a change because you're in that period. Now, what I would suggest, though, is that you make the change for the right reason. What particular thing about the company you're with now you find unsettling?
The bureaucracy and the ability to talk to somebody who really gives a rat's ass about me and my account is very difficult. And I call someplace and I might get an operator in the Philippines. I might get an operator somewhere in the States, which is very rare. But it's very frustrating. I want somebody that I can call and talk to and have a legitimate conversation about my requirements and my needs. And sometimes I call and I can't even understand what the representative is saying to me.
I understand that because if there's nothing that ticks me off more than that, and I have been known to say, and I am the last person in the world that's prejudiced, but I have been known to tell someone, you know what, give me somebody that speaks English because this is not going to work. I came
to that last week, and I didn't mean to be rude or anything, but I just said, I have certain needs here, and you're not meeting them. Can I speak to somebody stateside?
Nothing wrong. Listen, there's nothing wrong with that. Like I said, anybody knows me. There's not a racial bone in my body, but if you can't talk to somebody, then you can't talk to them, and you got to have somebody you can talk to. Here's what I suggest, Greg. Do you have an agent now?
I do, and she represents only the company that is currently insuring me and my son. And I really want another company. Can I give Cliff my information off air?
Yes, you can, and I'll give you a call because I am an independent and I represent.
I don't want to make it an advertisement for your company because I know you got a radio show and you're extremely independent, but I need some direction.
Okay, all right. Well, when you give Cliff your name and phone number, and I will call you over the next few days. Of course, it won't be for the next 2 days, but I will get to you first part of next week.
Yeah, Monday, Tuesday, Wednesday. That's great.
Okay.
Hang on, Greg. Hold on.
And I will say, in respect to what you're talking about.
Yes.
And to anybody who's listening, that is, I'm a recent Medicare inductee, but I'm still insuring my son who's in college, and the insurance marketplace makes it extremely confusing.
No
for
question.
People.
No question about it.
The elderly people that are on Medicare must be baffled by the insurance marketplace because I'm completely literate to the processes and the applications, but they still make it difficult, and it's very frustrating.
It is, Greg. It is very. Listen, I have to every year study for this stuff, and even though I've been doing it now for almost 9 years, I still have to struggle to sit there and make sure I understand all of the stuff, and they make changes, and you got to remember the new changes they made to the law, and then you got to pass a test. So it's a bear. But yeah, okay. But I'm gonna give you Cliff, and then I'm gonna proceed on. But thank you for calling.
Thank you very much, Rudy. I'll talk to you next week.
All right, hold
Okay.
on.
Okay. Now, I told you it's the initial enrollment period, the annual enrollment period, and then there's something called the special election period. Now, the special election period is not one specific number. There's a series of different time frames that could apply based on what constitutes a special election. For example, you move from Fort Lauderdale to Port St. Lucie, okay? You've just triggered a special election period. You will typically have 60 days in which to select a new plan, because remember what I told you at the outset. These plans are territorial. So when you move from Fort Lauderdale to Port St. Lucie, the plan you had in Fort Lauderdale does not apply anymore, okay? The other status could be that you become eligible for low-income subsidy, or you become eligible for Medicaid. Then you get what's called a special election period. But your agent should be able to tell you about that, and in those opportunities, you will get a special opportunity to enroll in a plan. The other thing that comes up in which you can enroll is if you're disabled. If you're disabled for a period of 24 consecutive months, you become eligible for Medicare, okay? So if you're disabled for 24 consecutive months, you are eligible for Medicare. Now, so the age is not a factor when you're disabled. So I got probably about a half a dozen people that are below 65 that are on Medicare plans. I placed them because they were disabled. And we got Steve on line 1. Yes, sir.
How you doing, Rudy?
Okay.
44 years old. I was totally disabled on Medicare.
Okay.
Age makes no difference. It's your medical condition.
Yep, that's correct.
And now I want to tell you a couple things about Medicare I don't like.
Okay.
I had 2 surgeries in the last 3 months. So Medicare then requires me to go have a wellness visit with the doctor to see how I'm doing. Wait a minute. I'm under the care of a half a dozen doctors, and they're sending me to a 7th doctor to see if I'm okay? That's a waste of money. The other one was, they wanted to give me a tetanus shot in the doctor's office, so they did. Medicare turned it down, said only a pharmacist or emergency room doctor can give a tetanus shot. I had a bleeding wound.
Yeah.
And I appealed it, and I said, are you crazy? The guy is a doctor, and you're saying a pharmacist has a higher standing on a tetanus shot?
Yeah.
So, but I'll give you the famous words of my friend who is deceased now. He hated Medicare his whole life. Before he died, he said, you know, Steve, I hated Medicare, but boy, am I glad I got it.
Amen.
You know, and that's the way America better think. You might not like it, but you better be glad you got it. Because go look at the death ages before Medicare in 1964.
Oh, yes.
And look at them today.
Yep, absolutely.
They come up
right.
about a decade.
Yeah.
So I'll let you go, but I just wanted to throw a couple cents in.
Okay, thank you, sir.
You bet.
Always a pleasure. Yeah.
Have a nice turkey day.
Yeah, you too. Steve is so right. If you go back before Medicare and look at how people were struggling with their health versus the elderly was struggling with their health versus today when we have Medicare, and it's just a marked difference. So, all right. So now you could be a disabled veteran. it could be a related disability, as Steve talked about. And another area where you can have Medicare, my niece, who I love to death, who's like 39 years old, has MS, and she gets Medicare. Thank God she gets Medicare. So just understand, so you can have your initial enrollment, annual enrollment, special enrollment, and a disability enrollment. Those are your options. Now, the other periods are, you can opt out and go back to regular Medicare after the first of the year during what's called the open enrollment period. During the open enrollment period, which is January 1st to March 31st, you can go from one Medicare Advantage plan to another, or you can drop out of a Medicare Advantage plan, go back to regular Medicare, and get a prescription drug plan. Okay? You could do either one. But you can't go from regular Medicare to a Medicare Advantage plan during the open enrollment period. I don't make the rules up. I'm just telling you what the rules are, but that's the rule. You could switch from Medicare Advantage plan to Medicare Advantage plan, or you can get out of a Medicare Advantage plan and go back to a Medicare and a prescription drug plan. Those are your options from January 1st to March 31st. Okay? Again, questions 340-1590. I know some of you are sitting there going, the guy is talking Chinese. I'm trying to make it as simple as I can for you. There's a lot more, and I've stayed away from all the acronyms that we usually use among insurance people. So, all right. Now, let's talk about plan options. This is always an interesting one. You can have Medicare and a prescription drug plan, or you can have Medicare supplement, Medicare, and a prescription drug plan, or you can have a Medicare Advantage plan without prescription drugs, and you can have a Medicare Advantage plan with prescription drugs. Okay, those are your basic options, okay? So we're going to talk about the thinking on those, but now, when it comes to the Medicare Advantage plans, you have some choices. You have an HMO and you have a PPO. HMO is a health maintenance organization, and a PPO is a preferred provider organization. Okay? HMO is more of a managed care, and a PPO allows you a little more freedom. You also have what's called a dual eligible plan. People who have Medicare and Medicaid are eligible for what's called a dual eligible plan. And Lord, if you're eligible for that, you virtually pay almost nothing because it pays almost everything. So that's something to be mindful of. So if there's anybody out there, what I find in some cases, there are people that have both and don't know about the special benefit that you can get for having Medicare when you have both plans, both Medicare and Medicaid. And 2 of the 3 companies I represent now give me the ability to go on and run a check, and I can find out online whether or not you're eligible for a dual eligible plan if you have your Medicaid and your Medicare card. So keep that in mind. And that's not just, there's other agents out there that can do that, but I'm just telling you what I can do. So just keep that in mind, okay? There's also the ability to get low income subsidy, which would help offset some of your costs. That has to be done through Social Security. That's not something that the insurance company can do. Okay, so now, what have I just done? Okay, when you choose a medical advantage plan, and I want you to hear this very clearly because people get so confused about this. When you choose a medical advantage plan, you do not give away your Medicare. I'm going to repeat that again. So if you go with company A, B, or C with their Medicare Advantage plan, you did not get rid of your Medicare. What you did is you choose to receive your benefits through a private company. That's all. Okay, so you still have Medicare, you're just getting it through a private company. Okay, and people are often confused about that, but that's the truth. You did not give anything away, you didn't lose anything. You're just making a decision that a private company will provide your Medicare benefits. Now, for your own peace of mind, I want you to know, in law, all Medicare plans are approved by CMS. A company cannot offer a Medicare plan that does not offer benefits at least as good as Medicare, your basic Medicare. I'll repeat that again. All Medicare plans must be approved by CMS, and they cannot offer benefits that are not at least as good as Medicare. So any trepidations you've had, if you're on Medicare, about getting a Medicare Advantage plan, I hope I just put them to rest with telling you that, making that statement for you. So, now that I've told you this, what should you do? Okay? You have to make some considerations about what type of plan you want from the ones I just described for you, and I'm going to help you with that too. First of all, I want you to know you cannot be rejected for any type of health condition. Nothing. It used to be that if you had end-stage renal disease, you could not get on a Medicare Advantage plan. Effective 1/1/2021, that's no longer the case. And technically, you don't have to answer any questions about your health. Now, as an agent trying to do a good job for you, I may ask you some questions about your health because that might help me decide what plan to put you in. But understand, I want you to feel comfortable to know that if I ask you that, that's not going to mean I can't give you a plan, because I got to give you one anyway, because I can't turn you down because you have a pre-existing condition. So here's what I'm going to tell you now. This is how I look at the selection process. If you have some serious illnesses that you are being treated for, you should probably get a supplement if you can afford it. Okay, I want you to hear that again. If you can afford it, all right? Because let me tell you what a supplement does. I want you to imagine an umbrella. Okay, I'm going to try to make a visual picture for you. That umbrella, you put that umbrella over top of your Medicare plan, and what it does, it drops down and fills in all of the gaps for your deductibles and the co-insurances that you'd be responsible for under Medicare. Your supplement picks up in varying degrees depending which plan you choose. You should also know everybody offers the same medical supplement plan. The difference is the pricing. Each of them have a little slightly different pricing, how they go about doing it. But a Plan G is a Plan G for all the companies, just so you know that for your own peace of mind, okay? So if you are turning 65, okay, and you want to get a supplement, there is no medical underwriting. So if you're turning 65 and you're on your initial Medicare enrollment, you can get a Medicare supplement plan without any underwriting. Okay, so keep that in mind. If you get one at a later date because you've decided that you want to be more secure and you go from a medical advantage plan to a supplement, there is going to be medical underwriting. They're going to ask about, now here they're going to ask about surgery scheduled, current illnesses that you may have, which they're entitled to do because it's a supplement, okay? But that's what happens if you want to go with a supplement at a later date. So if you think that you want to do a supplement, it's probably best you do it when you turn 65. But I will talk to you about that in more because there's some other things that you have to consider. If you go with a supplement, I want you to understand what your costs are. You got your Part B premium, okay? You got your Part D premium, which is your drug plan, okay? So you have your Part B under your Social Security that you got to pay. You got to pay your premium for your drug plan, and then you have to pay for your premium for a supplement plan. And the cost of a supplement plan, excuse me, is controlled by age. So as you get older, the supplement plan increases in price. All right? So that's why I'm saying to you, if you can afford it. People come to me and they go, I don't know if I can still pay for this. But here's the thing I hear. So understand that because it's by age, your premium is likely to increase each year. Now, one of the things that people tell me all the time is they say, that are on a supplement, they say, yeah, but I don't pay for anything. And I go, you don't? And they go, nope. I go to the doctor in the hospital and I don't have to spend a penny. I go, okay. So let's do a math exercise. How much is your supplement? Oh, I'm paying about $250 a month. How much is your prescription drug plan? Well, I'm paying about $50 a month. How much is your Part B premium. Well, that's $144 a month. I said, multiply that times 12. And the big light bulb goes off. Big light bulb goes off on their head. They go, oh, I guess I'm not getting everything free. No, and when you add that up, sometimes that bill would shock you. I've shown people they're paying $4,000 or $5,000 a year for a supplement. Now, I'm going to tell you this now. For a doctor will try to talk you out of not leaving your supplement. Okay? So, because they like the payment schedules for supplement. It's a little more liberal than it is with the Advantage plans, because with the Advantage plans they have to come to a contractual agreement with the company on what their compensation will be. Okay. Now, so we talked about the supplement choice. Next choice is Medicare plan plus a drug plan. I could get in trouble for this, but I'm just going to say, just as honestly as I can, it makes absolutely no sense to have basic Medicare and a drug plan. Makes no sense. That just doesn't make any sense to me at all. I don't know why you would do that, because if you do a basic Medicare plan, which you're going to pay your $144, and you do a drug plan, you got to pay the drug plan premium. And if you get a medical advantage plan, almost all the medical advantage plans around here, there's $0 premium. So you're not paying for this prescription drug plan, and you're still getting prescription drugs.
There are some prescription drugs that don't have any cost, like blood pressure medicines.
Yes. And a lot of the diabetic medicines, you get it, and they don't charge you anything. So while I may get in trouble for that, I'm just telling you the truth. That decision, and why, you know why the biggest reason why people have Medicare and a prescription drug plan? Because they're afraid. They have the fear of trying to figure out, and because it's so dagblasted complicated, as my friend Greg said, and he's right, people sit down and talk to somebody and they go, I'm just not going to do that. I'm going to stay right where I'm at because I feel much more comfortable there. But no, that just doesn't make any sense. Okay, so now we've talked about a supplement. Now we talked about Medicare plus a prescription drug plan. Now let's talk about a Medicare Advantage plan with prescription drugs. Now, I'm going to tell you, we talked about an HMO and a PPO. Let me talk about the HMO first. With the HMO, you get a medical manager. Your primary care physician is your medical manager. So if you have any kind of ailment, any broken bones, or something's troubling you, you have to first go see your primary care physician before you go see any other doctor. Now, there's another strange animal called a HMO POS, but I don't want to get into that to add for your confusion. But I will just tell you that now, if I have a client who's a bit older, that has limited mobility, more often than not, I will have them go to an HMO. Or I will suggest it. I can't make them do it. I will suggest an HMO because they get the assistance of helping to manage their care which they probably could benefit from. Now, the other side of that is all of your treatment will have to be done by the doctors that are in that network. Now, if my client is mobile and likes to travel and maybe has family up north, I'm probably going to advise them to do a PPO. Okay? A PPO allows you to go to doctors in the network and allows you to go to doctors out of the network. Okay? Now, one of the best benefits of a PPO is if, for instance, your doctor said the best doctor on the planet Earth for your condition is in Jacksonville, Florida. Well, you could go to Jacksonville, Florida to see that doctor. Now, the out-of-network costs to go see the doctor will be more, but at least you have the opportunity to do it and still have some coverage. Okay? Now, also, you can offer plans for military. I have a plan that I can offer retired military. Now, the plan for military, it does not offer prescription drug plans, but if you're retired military, you're probably getting all your prescription drugs from the VA. And that plan has, believe it or not, a buyback on that one. So you get your $144 back. So if anybody has a plan like that, or you're a spouse that has a full retirement plan, you can get this plan in particular, and it does have that buyback featured around here. Okay, now, are these plans better than Medicare only? I don't want to say better, but overall, with supplements and medical advantage plans, you get benefits that are not offered by Medicare. And I told you before, part of what's happening is the companies are competing for the business. So they're each offering various enticements to sign up with their company. So you can get vision, you can get dental, you can get hearing, and some even offer transportation to and from appointments. And one of the nice little bennies is some of them offer an over-the-counter benefit. So what does that mean? You might have one of the companies will give you a card to go to CVS, and CVS has labels for things that are considered over-the-counter benefits. And you can use that card to buy those things at no cost to yourself. And other companies have online ordering. So what kind of things can you get? You can get toothbrush, toothpaste. On my plan, I got an Oral-B electric toothbrush, vitamins, which is not covered under your basic drug plan. So all those things are available to you. And you can get a gym membership. A lot of the plans have what's called silver sneakers. So with silver sneakers, you can be a member of LA Fitness for free. Okay, so now what is the potential disadvantage of doing a Medicare Advantage plan? It's possible it could cost you more money out of your pocket because of the deductibles that you have to pay. But unless you're really sick, chances are, and I've proved this over and over again to people, you're probably not going to spend as much money as you're going to spend on a supplement and a prescription drug plan because you're paying 3 times. Your Part B, your supplement premium, and your prescription drug premium. And when you add that all together, that is a big number. So how do I decide? Here's what I'm going to tell you the first thing. If you're talking to an agent and you don't feel comfortable with the person that's presenting this information to you, go talk to somebody else. This ain't a debate. I'm not going to debate this with you. This is just a fact. This decision is for your health. And if you're not comfortable and you don't think the person is being straightforward with you and not giving you the kind of information you need to make a decision, do not do business with them. Talk to somebody else. There's plenty of us out there that are professional, that do Medicare, and you could find somebody else to talk to. Now, all of the medical advantage plans I offer are $0 premiums, which means you have no other out-of-pocket than your $144. So as you are beginning to mull over the decision, you can think about where your finances are. And listen, I want you to understand what I said before. If an agent, here's an important thing. If the agent tells you to talk to you, you got to give them money, don't talk to that person because we don't take money from people. We get paid by the company. So if you talk to the agent and say, yeah, I'll make an appointment with you if you give me $50, that person is unethical. Do not talk to them at all. Okay? Just, this is a FYI for you, okay? We're down to the last 2 minutes. I hope that was a lot of information. I even I shaved some off because I know it's a lot to digest in just an hour. But I hope that I shed some light on the choice of Medicare and some of the things to consider. But like I told you, the 2 things I want to leave you with, that if you are not comfortable, and I mean this from the bottom of my heart, if somebody's talking to you and you don't think that they have a clue what they're talking about, or you're uneasy with what they're telling you, go talk to somebody else. That's all. Not necessarily me. This is not a promotion for Rudy Howard to get your business. I'm just telling you for your own personal well-being, go talk to somebody else.
Now, if you want somebody who does know something about what we're talking about here, Rudy is the guy to go to. I'll say that.
Okay.
He's so humble.
That. Yeah, you can say that, but I'm not. That's not my point. But anyway, I'd like to thank you guys. I wish all of my listeners a very happy Thanksgiving. And I love you and thank you for listening to the African American Scene. God bless, and I will see you next Wednesday right here for the African American Scene.
The African American Scene with Rudy Howard, presented by Howard Insurance in Port St. Lucie. Heard every Wednesday evening in the 6 o'clock hour on WPSL, Port St. Lucie.